We've had a pretty interesting day sharing our thoughts with patients. I think it's important that patients share their thoughts with us. So I've asked 4 patients with multiple sclerosis who have had the procedure performed to share with us some of their experiences. I've invited Michelle Brown, Maren Rasmussen, Janet Grieco, and Florence to share with us some of the experiences that they've had in having the procedure itself and in their aftercare.
Hi, I'm Michelle Brown, and I was Dr. Sclafani's first patient.
I'm Maren Rasmussen. A lot of you know me from Tim's, where I post under the name CC quite a lot. I was Dr. Sclafani's patient this past February, and again this Monday.
Yeah.
My name is Janet Grieco. I live in Pennsylvania. I was not one of Dr. Sclafani's patients. I was Dr. Bond's patient in Philadelphia. He managed to do 4 patients before he shut down, and that's about where he stands. I've had the procedure 3 times.
I'm Florence, and I went June 10th to Bulgaria and had the procedure and have done actually very, very well since.
Do we have any questions?
Yeah, I think you're just supposed to talk about whatever you have questions on. I don't have any questions. Okay, well, coffee break. Yes.
Oh, yeah.
Why did you go to Bulgaria?
It was a year ago, and it was very new in the here. So for me, I live in Ottawa. It would have been a quick trip, but you couldn't Google Earth the clinic, and you couldn't Google the doctor, and I wanted something that I could actually do that with. So had it been now, I would have, done a short drive here, but I flew to Bulgaria by myself.
Go ahead.
Tell us about your symptoms and before and after sexual experience that you've had, any?
Okay, I'll start since I'm closest to you. I've had MS since 1998, and I was benign for 8 years, and then I started to limp, and as time went on, it got to the point where I couldn't walk, and I stopped driving, and I'm in a wheelchair. I can't move my legs at all. And I found out about CCSVI on Tim's and searched out a doctor on this side of the country and found Dr. Sclafani, so I was his first patient. And my first treatments were not successful because I'm the septum that you saw in the IVUS before, but I have been treated since, and with progressive treatments and finding all of the vein occlusions, I've gotten tremendous strength that I didn't have, strength in my legs to get up and down, which was problematic for me because I was at the point where I couldn't get in and out of my chair, on and off the commode. I needed my husband to lift me. It was getting to the point if I went to work that if I told somebody I needed to leave to go to the ladies' room, if I wasn't back in 15 minutes, they'd have to come find me. So I'm on my own. I have a husband and a family, but I know that I can be by myself all day and function, and I'm not bedridden, and I can get up and down. I'm not going to fall. My balance is better, and my strength is good. And for me, I think that's great. Thank you.
Go ahead, Cece.
Oh, yeah. You want to? Oh, sorry.
People have questions. Nobody gave me questions. So
We gave you like 50. Yep. Yeah.
She wanted to hear
Christine
about-
asked a
you're
question
done.
about each of us.
Yeah.
So.
I'm sorry.
Yeah.
Sorry.
Don't worry. But when we're done, we're going to do a procedure on Sal.
I was diagnosed with MS, relapsing remitting, back in 2006, but I had symptoms going back into like adolescence or a long time ago. I mean, my first experience with my right foot having an issue, which eventually was diagnosed as foot drop, but that was back when I was 20 that I first had an issue with that foot. And so it's gone very, very slowly for me. I've done very well, but a lot of my symptoms was the fatigue, the cog fog, the heat intolerance, all the global symptoms that go with MS. Was the question about how we're doing after the procedure, or just where we were at
Yeah.
before?
Yeah, where are you now?
Where I am now, it's a huge change, and I am really, really grateful for it. The heat intolerance, which I have had for a long time, this summer feels like the first summer in 10 years, because I am out there, I can handle the heat, I'm out there with the kids. Our air conditioning bill went down. My husband complains because he's got to be the one to turn on the air conditioning now, and I think I'm just showing off, you know. But it's remarkable that I can handle the heat when I really couldn't before. The fatigue is not, it's reduced, but it's not all gone. You know, I still, like, during our lunch break, I went back to the hotel to lie down for a little bit because we're close enough. But it's like you can make an accommodation like that and you can keep going.
I was diagnosed in 2002, and 7 years prior to that, I was diagnosed with fibromyalgia. So when I got to the doctors, I said, okay, is it MS? Is it fibromyalgia? Which is it? They said, you have both. But I truly believe that most of the fibromyalgia was MS in disguise. I would lose my ability to walk. I had the fatigue, and I would just shuffle. I didn't go anywhere without a shopping cart because that was my walker. I lost my dexterity in my hands. My handwriting got worse and worse. I would print or I would just type. I had optic neuritis, and I had a headache that would not give up. It would put me in bed for 2 days. I would have to medicate myself and basically sedate myself in order to get to sleep. I was on steroid therapy, 1,000 milligrams for 3 days, every 3 months. I was on that for 3 years. Things were getting progressively worse. I was losing my ability to walk more often. And then I found Dr. Bond, and things turned around. By the time I got back to recovery, my headache was gone. We got home, we walked around the neighborhood. I haven't needed a shopping cart in a year and a half. And my headache was gone, and I don't have to medicate to sleep. And one of the big things through years and years was I snored a lot and loud. And my kids would complain about it. My husband would get up and go sleep on the sofa when it was too bad. Mm-hmm. And that has gone away. And I don't snore anymore. And he actually says, I have to check to see if you're still breathing because it's so quiet on that side of the bed. And one thing I'd like to address is those of us with children that are older that seem to have problems, it needs to be addressed. We have a 34-year-old daughter that was complaining about always being tired and chalked it off to being a single mother of a 7-year-old and was dropping things and complaining about the fact that all her toes on her right shoes were worn out and complaining about headaches and tingling. And as a very active person myself, I said, this needs to be addressed. So I had her see a neurologist. She did not have lesions. They did an MRI. She does not have an MS diagnosis, but yet she had stenosis in 3 areas. I took her to Vascular Access Center in Philadelphia, and they ballooned open the lower jugulars on both sides, and she had a collapsed iliac vein, and that's been opened, and they feel that they may have to go back in and stent that. I have had a stent in my iliac. So when I started talking about this and the fact that my daughter had problems, there are a couple of other MS patients around the country that said, wow, that's the same as what I've gone through with my son, what I've gone through with my daughter. So earlier today when they were talking about genetics and not counting children as normals, not counting sisters or brothers as normals, we want to watch our kids. And we know what went on with us. So I feel that I have stopped or halted my daughter's ultimate diagnosis of MS. So she doesn't have that label. And I feel very strong about that. Thank you. All yours.
Thanks. I have a daughter as well who I have the forms to get her tested. She's 28 and there's some symptoms.
Can you pull the microphone closer to your mouth?
I was diagnosed about 10 years ago when I was 50, but I reckon I had it about 20 years at least, and again, other medical problems is what I attribute it to. I was really ill at the time. I blind, couldn't walk, talk, see, and a lot of those resolved. So by the time, a year and a bit ago when I was looking at going, a lot of the physical stuff had been managed. But what stayed with me really bad was the cognitive effects. I mean, I went to the neurologist, she said, draw a clock. And I said, a what? Well, I have a master's degree, and I'm an RN, and I couldn't draw a clock. So definitely, that was what stayed. Finding the way to the bathroom and back would have been a huge, huge effort. And talk about a humbling experience to be on the dean's list and the honor roll, and suddenly clock's a real effort for you. I had the procedure. They get you to see a neurologist before and a neurologist the day after in Bulgaria. I wish they could connect with the neurologist here. That would be awesome. I wish I had some kind of magic power that could do that. Before the procedure, they asked depression scale. I said 3.5 out of 4. And it wasn't a depression, it was a gloom that I couldn't get rid of. There was a fog. It's like everything was an effort to go. I had to walk a block to the pharmacy. I couldn't quite make it. Somebody's nodding their head. The next day, I went from it was a depression scale. My gloom scale was from 3.5 to 0. The brain fog, from whatever the scale was, to 0. And within the year, that cog fog that just takes away the whole quality of your life. You don't want to do anything. That lifted, and it was my esophagus vein blocked, and that was dilated, and I think that's one that stays open. So I've been very lucky with not having any restenosis problems. Word finding a bit, but not restenosis. Thank you.
Okay, now,
You have a question?
Sal, sorry.
I had a procedure just this Monday, since I was coming out here anyways. He hadn't checked my ascus with IVUS, and then he was going to see if there was re-narrowing, and my left had re-narrowed. It had been 99% closed in the jugular originally. This was back in February when it was opened, and then it had re-narrowed, and it was ballooned again, and now it's open again. It had re-narrowed to 60%.
What was the time frame between?
5 months, yep. But the other side had stayed all the way open. My right jugular had been 80% closed, and it was all the way open still on Monday. So that one had stayed patent, but the left one was such a severe stenosis. And I felt some improvements that first 2 days, and now it's like, well, is it the new improvements or the old improvements? Because one of my things is colors seem to really brighten after the procedure. So like these little blue things, if you notice them up on the ceiling, those are bright.
Excuse me, Sal. I'd like to ask them a question. I can wear perhaps the neurologist devil's horns for a moment here and have each of you perhaps briefly address the following question. These are wonderful stories, and they're certainly motivation for many people. But one of the questions would be, many MS people have to undergo rehabilitation. They need physical exercise. You can go to your doctors for better diet and better exercise. And when you do this, you often get some form of testing. And so there is some quantitative data that would have been done, I imagine, for any of you who might have had this type of help from a rehab center. They will test your ability to walk. They'll test your muscle strength. They'll test your speed. They'll test many things like this. So there may be many sites like this, Sal, around the United States where many MS patients are getting tested like this. And that is important data where now that you've been treated, I assume you may or may not have gone back to that same place, but if you did, you have an objective measure by a professional who can say, not that your stories aren't important and interesting, but if I were a neurologist, I would be saying, well, what are your improvements and scores, rather than hearing a subjective improvement. So this is important, I think, for all MS patients. Any type of quantitative data that you have from any type of care that you've received And then hopefully you go back afterwards, because I assume after treatment you don't get instantaneously better. You still need to undergo rehab. If you haven't been using your muscles, you need to build up your muscle strength. So those sites are going to provide critical quantitative data that can be reported, maybe even eventually one day used by an IRB that like Sal has now. So Michelle, can you comment a little bit on this? And if any of the other three have had anything like this, let us know.
I had been going for physical therapy several years ago, and as I got worse and my mobility decreased and both of my legs went out, I was told by my therapist not to come back because I couldn't even have the energy to stand up and down 2 or 3 times. That would wipe me out and I'd be done. But after the first time I was treated from Dr. Sclafani back in 2009, I fell from the Coumadin. I lost my strength. And I landed up in physical therapy because I whacked my knee and twisted my ankle. And so I started physical therapy then and kept going. And it was because of the ankle. Eventually, my insurance cut me off, so I started doing it for the MS. And I have a very limited lifetime supply of it. And so I was hitting my limit. But Dr. Sclafani treated me again last June and ballooned my left jugular, the right one, was the first time, and that one's occluded. Never did the esophagus because, again, at the second time he didn't have the IVUS and the first time wasn't imaging correctly. But when I went for physical therapy, pre and post the second treatment in June 2010, my physical therapist's mouth dropped open when I went the next time because not only was I able to get up and down myself a lot more times than I had 2 days before, but when I was ready to get on the table to stretch, I said, just give me a walker and I'll get there myself. And he, handed me the walker and he watched me get out of my chair and shuffle over onto the table where 2 days before that, he had to carry me out of my chair onto the table to stretch my legs. So we worked on that all summer. Eventually, I went back for treatment in April of this year because I knew that I needed my esophagus looked at, especially because all of my lesions are in my neck. And now it's opened and it was blocked. But I don't have any physical therapy left in my insurance. That's it. I'm done for the rest of my life. So whatever I do, I just have to do on my own. But I do have more strength now, and I know that I can do it on my own.
To Dr. McDonald's point, it's great to have quantitative proof before and after, but neurologists generally don't need any quantitative data on the severity of our symptoms because the majority of our symptoms cannot be quantified. So it's nice that they keep throwing this out there that, there's no proof that we're actually getting better. How is this placebo? All of our symptoms are, in a sense, placebo.
That's exactly what I was going to say. I took, Research Methods 101 like 35 years ago, and you were told that, you tease out all the variables and you take the one variable and then you can test. And I believe that premise for whatever years, I'm 60. So, but I don't believe it anymore because with MS you have so many variables that are interrelated and interdependent. And I can't even define them myself. Some of them I see, some of them my doctor sees, some of them my friends see. And so the research that that you're an expert in doesn't there's other ways of doing research. I don't think Darwin discovered evolution by doing a double-blinded study. I'm quite sure of that. Or Newton, when the apple fall on his head, here's a double-blinded study here I got to do. So it's so interrelated and it's so complicated and complex when I haven't been able to walk. It's been sometimes my legs are heavy, sometimes because I'm dizzy, sometimes I'm fatigued. It's not one thing. And I think your brain's so complex. And when we do this double-blinded thing, I sometimes, I think I'm glad, kind of Darwin discovered evolution before he had to do a double-blinded study. But people say I'm more present. I started an exercise class, 2 weeks ago. I wouldn't even have thought of that until after the procedure. So there is something to be measured in a lot of sense.
Dr.
Said that.
To answer your question, over the years I've been religiously getting my MRIs every 6 months, seeing my neurologist, having all the scores taken. Since my procedures, Dr. Bond would have me fill out the quality of life questionnaire from Stanford, and I would submit that back to him, and my numbers were always increasingly better and better. And 6 months after my procedure, I had an appointment with my neurologist. Actually, I have two neurologists. One dismissed me, and the other one is very interested and wants to keep track of me and follow me, which is wonderful. I had an MRI 6 months post-procedure. It showed no lesions in the spine, where I did have lesions before, and no new lesions, nothing illuminated. So it was, and I have another appointment in another 6 months for the next step in the following. So this neurologist is keeping close tabs on me because he's interested and he's not totally against it. So kudos to him.
Have any of you ladies stopped your crab medications if you're on them? So have I, and I'm feeling a lot better.
I had been
That's
on
great.
Copaxone, and I stopped it back in August.
I was on Avonex close to 5 years after the procedure. I stopped it for the last 6 months now. I see my neurologist in about 2 weeks from today, and he's going to be really surprised of what I've been doing lately since last October.
I was on
excellent.
Rebif for 8 years, and I kind of weaned myself off of it. And when I saw my neurologist the last time, he said, "Are you still on Rebif?" I said, "Well, I'm kind of weaning myself off." And he said, "When was the last time you took it?" I said, "Last Wednesday." He says, "You're done." He says, "I can't say I'm happy about it, but I guess I'm not going to change your mind." I said, "Nope."
My neurologist took me off of everything because nothing worked.
Okay, we have to,
Oh, sorry. Zero. Don't walk.
Yes, I mean, my neurologist looked at me. He didn't do the timed walk or any of that. He gave me the regular neurological exam and said, "You look great." So that, I mean, I don't have an official score. I just have his records.
okay, we have to stop this, because I'm going to get in a lot of trouble. Come on. We have one more event on here, so thank you, ladies.
Thank you.
I wish we had more time.